Oh, it's on that mode, Mia, where it's got the next slide up as well.
Oh, really?
Yeah, I'm not sure why.
Okay, 1 second. Let's do a different mode. Is that better?
Yes, perfect.
Okay, great. So welcome everyone. It's really nice to be with you today, and thanks for joining this session. Emily Stapley and I are going to present this presentation, which is embedding support across the system. What do we know from HeadStart and beyond? And then also on our team is Rachel Piper. So Rachel, if you just want to have a little wave. And so Rachel is the Youth Engagement Officer, and she will be sharing a little bit about sort of from the young people's perspectives. And we also have Benjamin Ritchie from CORC, who's going to be providing technical support, but is also kind of a fascinating person if you want to reach out to him as well around his research and work within CORC. So let's get going. So basically the context for this presentation is some research that was done as part of the evaluation of HeadStart. HeadStart is a 6-year program that's been set up by National Lottery. And the aim of HeadStart was to explore and prototype and test new approaches to early intervention in relation to young people's mental health and well-being, and also around sort of the prevention of risk behaviours. And HeadStart programs were rolled out within 6 local authority-led partnerships across England. So sort of from inner city Newham to Cornwall to quite sort of far up north in sort of places like Blackpool. And the HeadStart approach aims to provide specific activities and interventions for young people. And many of the interventions were formed with young people and based on sort of feedback and consultation from young people about what they both wanted and needed. And there are a mixture of whole school and community-based approaches. So they might include things like peer mentoring, as well as more kind of group therapy or mindfulness sessions for young people. There were also sort of whole school approaches to sort of creating systems change and creating improved mental health for well-being. So school staff training was rolled out in many of the areas as well. And there was also some groups for parents and their children to provide support in relation to sort of both mental health more generally and specific sort of mental health difficulties. So the evaluation of HeadStart has been conducted by the learning team, and this has been led by the Evidence-Based Practice Unit, which is a partnership between UCL and the Anna Freud Centre. And local evaluations in each of the sort of geographical areas were conducted at each partnership. And we were trying to find out what does and doesn't work for young people, and what might also benefit them in the future. As a 5-year program, we had the strong advantage in that we could get feedback and collect data with young people longitudinally, so it gave us a chance to have that sort of longer term perspective. So I'm going to talk to you about one of the research projects that we did, and then I'm going to hand over to Emily to take you into some other research projects. And so the one that I'm going to talk about now is really looking at kind of the factors, the protective factors that protect young people's well-being in the context of risk. And just as a kind of recap, protective factors are any factor or variable that decreases the risk of a young person developing a mental health disorder or increases their well-being. Excuse me. And so we conducted annual research interviews with young people over 5 years. Sorry, I've got a slight cough. It's not COVID though, I tested this morning. And we spoke to 63 young people aged 9 to 12 across each of the HeadStart partnerships. And we wanted to get their sort of lived experience of risk and protective factors. So within the current sort of psychological literature, there's a really strong evidence base on risk and protective factors, but they tend to be risk and protective factors that have been worked out quantitatively. And we wanted to understand from a young person's point of view what they felt helped their mental health or made looking after their mental health more difficult. And so what we found was that there was a lot of variation with the sort of type of support and the extent that, excuse me, that young people could draw on the support around them. So a proportion of young people described that they had lots of different support in relation to their well-being. So it could be from parents, or it could be from their friends, or from a supportive teacher, or people within the community. And then there was quite a large proportion that also had uncertain sources of support. So this is where they may have had specific risk factors at home, or they actually found they wouldn't go to their teacher if they had a problem, or they had a lot more uncertainty and ambivalence about where they would go to for support in when they were experiencing risk or a problem. And then there was a sort of smaller group of young people that described drawing on themselves and their own strategies for support, which I'll sort of go into in a minute. Excuse me. So just to give you some examples. So in this first category, young people with multiple sources of support talked about their parents, talked about feeling loved and not having any problems. And this sort of fits with what we know from the literature, that warm and supportive parents increase young people's well-being and reduce the risk of a range of outcomes. And then young people with uncertain sources of support sort of talked about having quite a lot of problems and not really knowing what to do with it. So this particular young man talked about kind of his parents' sort of poverty and his mum's illness and disability, and not really knowing what to do about it, and not feeling like he would be understood if he did go for support from someone. And then, so this third category, sort of young people, these young people felt quite sort of independent and quite in control of their emotions, and able to sort of manage the situations that they found themselves in. So here's that sort of model, but just sort of broken down into the range of supports that are available to young people. And obviously, in relation to risks, coping is also a major factor, and something that we looked into quite in depth, and to sort of understand the different ways that young people would cope in relation to the problems that they had. So, coping could be anything from sort of talking to a parent, to watching TV, to going out to sort of play, to sort of unwind from a particular problem. And obviously it varied in relation to sort of different risks and stresses faced by the young people. So what this sort of tells us is that there's sort of various systems around a child where they can potentially draw on different types of support, or they may not feel that they have support within those sort of surrounding systems. And obviously it's highly variable to each young person. And this sort of fits with a socio-ecological approach, that there's sort of these concentric circles around the young person, and there's different levels of kind of risk and protective factors within each of those circles. And what we found was that the sort of young people with many sources of support tended to have those stronger links with many systems, whereas young people with the sort of self-initiated or uncertain sources of support had sort of more tenuous and potentially less reliable links with other systems, even though they may sort of have contact with multiple systems. Whether they felt they had sort of trusted relationships or strong relationships in those systems was really variable. And so this led us to think, sort of given what we'd learned about protective factors, how might this change over time? And as I mentioned, the Head Start sort of data set was a really great opportunity to look into this, because we could check back with young people each year to see how things had changed. And so yeah, thanks for bearing with me with my slight tickly throat, but I will hand over to Emily now to take us through the next study.
Thanks, Mia, and you'll have to bear with me, Mia, if that's all right, if I just ask you to change slide at the end of each one.
Of course.
So the next research project that we conducted looked at change over time in young people's experiences of difficulties and support. So you may remember at the start of the presentation, Mia mentioned about the longitudinal nature of the research that we can conduct through Head Start. So this study very much took advantage of that. And the reason that we're able to do this longitudinal research, so looking at change over time, is because Head Start is such a long program. So 5 years from the outset, but actually now 6. So there's a lot of research opportunities for us within that. So this study was also situated within the Head Start qualitative longitudinal study that Mia's study was part of. And in this study, we looked at the interviews conducted at time 1, so the first year of the wider study, and that was 2017-2018, so approximately the first year of Head Start. And that was the year that Mia's study that she's just spoken about was also situated within. But in this study, we also looked at the interviews conducted with young people at time 2, so around a year later, so roughly sort of 2018, 2019. So in total, we had 78 interviews with 78 young people across the 2 years of Head Start. So an absolutely enormous amount of interviews to get to grips with, really. So there are around sort of 12 to 16 young people at each partnership who we interviewed, and they were aged sort of around 9 to 12 in the first year and 10 to 13 in the second. So our aim with this particular research study was to look at change over time from time 1 to time 2 in young people's experiences of difficult situations and feelings and any support or services that they received. Thanks, Mia. So what we found, and very sort of similarly to Mia's studies, we found that there is clear sort of variability in young people's experiences of life and support over the first 2 years of Head Start. So we divided the young people in our sample into 3 groups. And these were kind of broad characterizations of what was going on for different groups of young people within our sample. So the first group were young people who talked about their feelings and their experiences and their relationships as going well by the second year of Head Start. So there were 29 young people who reflected this group. And they were young people who actually had a relatively low need for support by the second year of Head Start, or they were receiving support which actually was really helpful. And that might be from Head Start, from friends, from family, or other professional sources. And that actually was really helpful for them. So for them, things were going well. They didn't really feel like they needed anything extra to help them. Then in the second group, which was a bit larger, so 36 of the young people who we interviewed, they talked about ways in which their feelings, experiences, or relationships had improved, but also ways in which they might have deteriorated. So things might have got better in some ways, but worse in others. And we described this group as the young people for whom things had gone sort of up, but in some ways they'd also gone down. So there was a real mix of experiences going on here. And for these young people, there was a sense that they might not necessarily always have got what they needed from support. So they might need a bit more, or they might need something different. Or it might be that some elements of support in their life was helpful, but for some it might not have been. So some of the young people might have had very helpful sort of friends and parents, but others may not. So there was a real mixture of things going on for this middle group. And then the last group, which was our smallest group, and it was 13 young people who talked about how actually by the second year of Head Start, their feelings, experiences and relationships have been quite difficult. And these were the young people who we saw as needing the highest level of support by this second year. So they were the ones who perhaps hadn't got what they needed from support up till now, or maybe they hadn't had support at all and they needed it. But these were the young people who we felt within our research sample were those who could really benefit from something additional at this time point. Next slide, please. Thanks, Ria. So what does this tell us? So these findings invite us to think about the extent to which young people in need are being identified for support. So are the right young people being identified at the right time and for the right difficulties that they might be experiencing? Are young people receiving or engaging with support that they're being offered? And are they actually getting what they need? So is the support that they're being given from a whole range of different sources in their lives, so HeadStart, parents, friends, teachers, other professionals, are they actually getting what they need from that? So it's really crucial, I think, that when we think about the support that we're talking about in these research projects, we're referring to lots of different types, and it's both sort of formal professional support, but also informal sources of social support. Okay, next slide. I think, yes, lovely, thanks, Mia. So that was a whistle-stop tour of the second study that we conducted with our qualitative interview sample. So I'm going to shift gear for our last study, and I'm going to talk about a study that's used our big quantitative numerical data set now, which we've been collecting over the course of HeadStart. And this study is led by Holly Bear, and it's called Learning from HeadStart, Changes in Perceived Social Support in Adolescence. So for this study, the data set that we used came from the wellbeing measurement framework. So as part of HeadStart, young people in the HeadStart areas have been completing the Wellbeing Measurement Framework, or WMF, yearly. So starting in 2017, when they were in year 7, and then the data that I'll be speaking about now is up to when the young people are in year 9. So it's 3 years worth of this quantitative data. So that's given us a sample size of about, well, nearly 11,000, which is huge. So just very briefly, the WMF, for anyone who hasn't come across it before, is a year-on-year school-based online survey, which was developed in collaboration with the HeadStart partnerships, and that we use in HeadStart to measure well-being and resilience in children and young people. Thanks, Mia. So what did we find from this sample of nearly 11,000 young people? So when looking at their data across time, what we find is that social support does change during adolescence and over time, but in different ways. And in some ways it changes and it decreases in terms of perception of support from the community, perception of support from school. But in other ways, it doesn't change as much. So for home support and peer support, young people's perceptions of those as supportive entities, they remain stable across time. But what about in terms of differences in perceived social support, so between sort of adolescent boys and adolescent girls? So what we find is actually there are differences there. So in year 7, girls report more of any type of support than boys, but in year 9, the picture is more mixed. So in year 9, in terms of peer support, girls are still reporting more than boys, but in terms of school support, boys are now reporting more than girls. But for home and community support, actually there's similarity in terms of the levels of perceived support from community and school, community and home, sorry, for both boys and girls. And then finally, is perceived social support linked to wellbeing? So from our big WMF data set, we would conclude yes. So all of the sources of perceived social support that we measured using the WMF are positively linked to wellbeing for young people at both year 7 and year 9. But the caveat with this finding is that we can't conclusively say that one causes the other based on the type of analysis that we conducted to look at this. So we can say that they are linked or related, but we can't say that definitively that there's a causal relationship there, if that makes sense. So what does this tell us? So what this says is that potentially by boosting young people's access to supportive relationships, this is a step that could be taken to support and improve young people's well-being. It also tells us that interventions should aim to establish and reinforce connections for adolescents across contexts, which is very reminiscent of the conclusion that Mia drew in her study about sort of the young people with multiple sources of support and multiple connections to systems, sort of having sort of beneficial experiences of support and in terms of their well-being. And that what we should do through interventions is that we should aim to reinforce support and connections in multiple areas of young people's lives. So whether that's at home, community, school, or peer level. And the final thing that I wanted to say is that also in relation to this last study, we've been thinking, so with Rachel, who's going to talk about this a bit further in a bit, we've been thinking with Rachel and the HeadStart National Young People's Group that Rachel runs about what we can do with the findings from this study that I've just spoken about. So how can we disseminate them so that lots of people read them and engage with them? And are there any other ways in which we need to think about them and sort of situate them contextually? So to do this, we've asked the Young People's Group about their own experiences of social support and how that has changed over time. And learning from speaking with the young people in the group has been primarily around sort of the support at school and what that means to young people, and also the importance of support over the transition from primary to secondary school. And the young people in the group also spoke about the specific experiences that you might have as support relating to different aspects of your identity, so such as LGBTQ plus elements of identity, and the importance of sort of considering this. And then, as I mentioned, we also asked the group to think about how to present findings from our research to others. And the picture on the right just shows the sort of range of ideas that they've talked about. And the task for us and the group as next steps is to whittle these down and think what is going to have most impact and enable us to share what we found with the world. I think that's all of our slides now. So what we'll do is, if you're okay to stop sharing, Mia, then we'll open up and see whether anyone's got any questions or reflections or thoughts at this point. They can be as fully formed or not fully formed as you'd like. But yeah, we'd really welcome hearing from others in the room.